board-certified dermatologist practicing in Miami, Florida. Today we'll be treating my patient Robert with a little bit of toxins as well as some fillers. Part of the normal aging process is that everybody loses volume in their face over time. It's just like taking air out of a balloon. So you can see over time that he's lost a little bit of volume underneath his eyes right here. You can see there's a little bit of a depression. He's also lost a little bit of volume in his cheek. And as a result of that loss of volume, the face falls forward and forms the lines here and here. So we'll be replacing the volume here, putting a little bit in his cheek. We don't want him to have a fat cheek, but just putting a little bit of that volume back. And then we'll be softening the lines here as well as over here so that the results are a very natural aesthetic. The other thing that we'll be utilizing is a little bit of a toxin. So usually people think of toxins of being able to help to relax the lines of movement. So if you just raise your eyebrows for me, and then you can relax. So over time, these lines have almost become engraved into his forehead, as you can see in the prior video that we did for YouTube, which shows my physician's assistant, Gentry, being injected with a toxin. So for Robert, after we do the injections, these lines will have significantly softened, as well as softening the movement in his face. So we're going to go ahead and get started with the filler. And then Lauren's here to pat his shoulder if he's nervous. Okay, so you can just lean back your head a little bit there. Good, and just relax. Sometimes you can hear a little bit of a snap, crackle, pop sound just as the filler is going through the syringe, so it's nothing to be nervous about.
Okay.
Doing good. So the fillers are made of hyaluronic acid, which basically are just man-made versions of the same material that you can find in your own skin. So the great thing about those fillers then means that you can't be allergic to them. So he just has a little bit of pinpoint bruising in the area, which will go away like within the next couple of days or so. But we're just going to show you so that you can see that half and half in terms of the facial comparison. So the thing is that when you look on one side of the face, on this side of the face, you see where he has that indentation right there, and where there's a little bit of that downward fall of the center part of the cheek, and that results in the fold here as well as at the corner of his mouth. Whereas when you look on this side, you see that we filled in that indentation. We've softened the lines over here as well as down here. So it just gives his face a little bit of a lift on this side. And that little bit of swelling will go down as well. Good, I'm just going to move over to the other side. Okay, so now I'm going to be finishing up on the left side of Robert's face. You can see a big difference between the right and the left side already. But I'm going to go ahead and concentrate on this little fine line right here, the nasolabial fold. He's just a little swollen here. We're going to smooth that out with a little bit more filler in his cheek. And then I'll be doing the toxin in his forehead. And then we'll be following up in 2 weeks so we can see his final results at his follow-up appointment. So we look forward to seeing you then. Thank you. Hi, so we're here with my patient for his 2-week follow-up after having some toxin as well as some filler done. So we're just going to go over his final results. So if you take a look here, this is his picture from 2 weeks ago. So if you look at his forehead, you can see how he had these lines that are etched into his forehead. But when you look now, you can see that those lines are significantly softened. Also, if we take a picture from before when he was raising his eyebrows, you can see how we really helped to soften that muscle movement here. So if you look now at him and you raise your eyebrows, you can see that he still has a little bit of movement there, but it's a lot softer than what it was before. And as a result, those lines aren't so deeply carved into his skin. The other thing that you can see here in the picture is how the texture of his skin was a little bit fine and wrinkled underneath his eyes just from that loss of volume over time. And you can see how he'd lost some volume in his cheeks, and that had caused the skin to fall forward and cause these folds here and here. However, this is his before and overall picture, and you can see here we have the live after. So you can just tell how we helped by doing the filler underneath his eyes, how that really changed that texture of the skin there. And then we did some of that filler in his cheek to bring back that angle of the face, and that lifted and softened the fold over here. We also did some filler over here along his jaw where he had lost some volume, just to round it out again. It's important to remember that everybody has it where their face is a little bit asymmetrical. So it's normal to have one side a little bit smaller than the other, which in this patient is his left-hand side. And as a result, his nasolabial fold is a little bit deeper on that left-hand side. And we want to respect that asymmetry that people have because you don't want them to look like a weirdo. That is not the look that we're trying to go for. So basically, we help to soften those lines on both sides. So without knowing that I'd done his injections, meeting him, I wouldn't know that he had any filler or toxins done. He just looks fresh with a lot of relaxation of those lines in his face as well as that loss of volume. So overall, if you just look at it, by side, you can see how we really improved just the overall look of his face. It's important that you don't wait until all of the filler and the toxin is gone because you don't want to have to fill all the way back up from baseline. It's really something that you want to maintain by getting treatments done every 3 months for the toxins and approximately about every 5 to 6 months for the fillers. Basically just like topping off your coffee. Thank you.